neurosurgery when looking at her initial CAT scan or MRI would have been quite shocked and quite worried about it. Even neurosurgeons looking at it, however, would be quite impressed by the size of her brain tumor. By the time she had asked for that CAT scan, she was starting to suffer from problems from increased intracranial pressure inside of her brain, and that is a life-threatening situation. In her case, the most striking problem that she presented with was a visual disturbance affecting both of her eyes, which was directly related to the location of her brain tumor. And at the time of her brain tumor resection, she did run into some issues with bleeding from this brain tumor. One of those questions would be, how likely is the tumor to come back? And overall, statistically, based on her final pathology and the fact that we were able to completely resect it, the likelihood of her having a recurrence is less than 1 in 10. The other part of the recovery or prognosis, however, is the amount of brain injury which was done beforehand. And unfortunately, that has a worse prognosis because I think she likely developed some permanent neurological deficits prior to her surgery. If anybody is presenting with a headache which is abnormal for the person and it does not go away and it is associated with things like nausea or vomiting or some other type of neurological problem, I definitely wouldn't ignore that, and that is something which should require medical attention. There are a few things which we believe impact why they form, which would be radiation exposure, certain types of viruses, and certain genetic conditions. But in the vast majority of patients who develop meningiomas, none of those things are evident, and we are left not really knowing why they developed in the first place.